climate change, actually the impact of climate change on the workers in the community, you heard this morning, and it's actually one of the pillars of the future of work agenda. So you've heard about new technology and types of contracts, and this one is also important because, of course, it's something that is to take into account for the future and in the occupational health and safety field. So when we talk about climate change and impact of the climate change, of course, we have to remember what are we dealing with. So we have carbon dioxide, methane, nitrous oxide, ozone, black carbon, and all these fluorinated gases, all of these here, which are part of the problems, and their increase in the atmosphere in the last 20 years or so. And so I think it's an important point to remember. So we have the drivers, the typical drivers of the climate change: increased temperature, extreme precipitation, extreme weather events, and sea level rise. Then we go to the exposure pathways, poor air quality, including, of course, extreme heat, but also poor air quality, reduced food and water quality, changes in infectious agents, and then the health outcomes. So I'm going to focus on these. So we have heat-related stress, cardiopulmonary illness, food, water, vector-borne diseases, pollen allergies, mental health and stress, which is an important point of the whole discussion here, and the chronic kidney disease, which is an epidemic that is being sort of seen as one of the, probably the first epidemic that can be related to climate change. And so this is very recent. In the second week of August, there were public safety concerns declared for 13 states in the U.S. due to heat wave. So cooling center, water distribution provided for outdoor workers, and so this is a real problem in this country and all the other countries that are impacted by increasing temperature. Of course, we have workers that are more at risk. Paul Schopti is not here, but he's the author of this first review published in 2009. This is actually, I think it's still, well, of course, it needs to be updated, but I think this is a very core study, very core review that you can refer to all the time. You think about this problem because you have to consider who is more at risk. What are the occupations? What are the job tasks that can expose the workers to climate change? So we have, of course, agriculture, construction, transportation, oil production, landscaping, firefighting, emergency response in terms of outdoor, but of course we have also increased temperature and problems for the indoor workers. Think about steel mills, dry cleaners, manufacturing, commercial kitchen, warehouse. And then we have workers in natural environment, soil, those working with soil, water, animals and infrastructure, forestry, veterinarians, and all these type of occupation that are related to it. In extreme rain, workers also who maintain septic or sewage system, plumbing and water system. So again, a very good review of climate change and occupational safety and health, preliminary framework considering jobs and sectors that are to be kept in mind because they're like the forefront of the exposure in that matter. So cardiovascular, number one. Very simple, sort of trying to provide the elements of the mechanism here, increasing the temperature, increase the blood viscosity, thrombogenicity, cardiac demand, and heart strain for the doctors and nurses and those who are in the health part of this. This is kind of a sort of a basic mechanism leading to cardiovascular heat stress, and the result of that is that as a classical picture here showing in Paris, this was in 2003, daily temperature and death just due to cardiovascular diseases and in acute sort of heat wave, and this is what happened in Paris at that time, and this is being reported because it's a very strong example of what does that mean, the implication of heat waves on cardiac heat stress and death for the heat waves. So it's another classical figure for just showing you that these are the OSHA reported outdoor worker heat-related fatalities, 2008, 2014. It's not really updated, but it overlaps overlaps on the area where you have a higher temperature. So we have a lot of this representation when we talk about impact of climate change on workers and community, because of course you have to consider this type of spatial analysis with maps and overlapping maps, mapping the temperature in a certain period of time, of course, and health outcomes. So it's a typical way of, in all this research on climate change impact on human health, basically it's actually doing this, sort of trying to match geographically and epidemiological data related to the areas that are more at risk because of the increasing temperature. I think that all of this type of work here is going to be extremely facilitated by new technological advances using satellite data, because we're using satellite data. You can apply algorithm and have an estimate pretty accurate of the temperature every day with the definition, which is now about half a mile, but is becoming more and more narrow. So using the technology from the satellite data, all this mapping and geographical representation of the temperature going backwards of 10 years or so, of 12 years, I think, when the satellite technology started to be able to provide this type of information, this is going to be, all these maps is going to be, are going to be improved a lot by the utilization of this satellite technology. Another classical representation of the mechanisms and all the parameters that are involved in the heat-related stress and high temperature, direct sun exposure, indoor radiant heat sources, limited air movement, not enough fluids, physical exertion, PPE and clothing, physical condition already pre-existing, use of medication, pregnancy, lack of recent exposure, advanced age, and previously related. So these are all factors that are very, very important to consider for each worker who is exposed to heat. And so they have to be considered. And these are also very important because it can give us a lot of chances for prevention, obviously. So we have to consider all these factors to be able to do something intervention. Of course, the most important ones are here, not enough fluid. You cannot work, of course, outdoor with not enough fluid. This is terrible. It's going to increase the risk exponentially. And also the physical exertion are absolutely important. I think that the two of them combined are probably those that are giving us a more sort of element to think that they're the very, very important on larger scale. So there are recommendations that the clinician should think about for their patients already having cardiovascular diseases, because when the heat wave is coming, we know about it, and there are a lot of things that must be done in terms of regulating the treatment of the cardiovascular patients. For example, adjusting the doses and eventually temporarily suspending drugs during the predicted heat wave of all these types of medications. So the doctor should really know about this and try to work to avoid any problems that could be given by combining a certain treatment and the heat stress, because of course there are certain mechanisms that work in the same way, and therefore they could impact the cardiovascular system. So advise about heat cold exposure. These patients provide hydration, value of even a few hours of air conditioning, provide sources of emergency heat information to all these patients is fundamental. Advise about alcohol, because of course there's a diuretic leading to water loss, to reduce inability to lose heat through sweating. And basically also educate all the patients about air pollution, because air pollution is another risk factor for cardiovascular disease, and the two of them treat increased temperature in a heat wave and high air pollution in certain areas can be actually important factors for cardiovascular patients. Many patients are unaware of this problem, so we have to provide information before actually the heat wave is coming. Vector-borne infections is another important point related to all these problems with climate change. So we have basically increased exposure to these type of vectors, and you see that here there are different types of them, but they're all capable of sort of providing exposure and increase of infectious diseases. For example, the Zika virus here is represented in these countries where, of course, the temperature is rising. And, well, the U.S. in general, of course, certain parts of the U.S., and so this is an important point to keep in mind. You see that the changes also related to the Zika exposure that become more evident over time with the increase of temperature. So Lyme disease, you can see here a representation in 2001, and this is 2013. So there is an increase of Lyme disease in certain areas of the United States, which is also related to the changes of temperature. And not only changes that are geographical, but also in terms of the seasonal. So the Lyme season is classically April, May, October, but we have in certain areas of Long Island, etc., also shifting into other parts of the year like November, December, and January. So there's not only a change in the geographical location, but also in the timing and the time of the year during which this is actually happening. And now we consider also natural disaster and the increase of infectious diseases. So of course, it's another type of implication here with natural disaster and the humidity, etc. But there are certain types of infectious vector that can be considered here due to different mechanisms. Because after these hurricanes and flash and floods, we can have salt water into water and food supply, number one. Fresh water or soil organism in as above, and sewage contamination due to overloaded sewers and storm drains, and then displaced animal vector. These are four fundamental mechanisms here, and according to these mechanisms, we have different type of infectious agents that can sort of increase the exposure for workers and the communities that are actually in the impacted areas. And this is an example from Katrina and the cases of cholera and Vibrio and norovirus that were actually important in that context. Then we have problems due to pollen, pollution, and asthma, of course. This is another big chapter of health impacts on the workers. And mechanisms also here are important to understand. CO2, carbon dioxide levels in the air can promote the growth of plants that release allergens. So increasing the temperature, increasing the carbon dioxide, increasing ozone can lead to this. Pollen season length, production, and amount of major rock-with allergens that increase in response to elevated ambient levels of carbon dioxide. So these mechanisms are important to understand. I think that the literature here, the scientific evidence is quite solid on these problems, and yeah, we have to, of course, put together one more time all the data, and we have, for example, the CO2. You know, the increase of the CO2, it's really drastic. And here, other types of studies looking into the time of the year when you have flowering and so the production of the pollen. This is in Spain, and you see that there's a decreasing time constantly happening for the season where you have the pollens. And so therefore you see these trends over time. Mental health is another important chapter that we have to consider, not only cardiovascular and infectious diseases, but there's also a big literature on the impact of climate change on mental health in various aspects. And we have studies like these that are actually looking into the elevation, classical study design. You look into the elevation of temperature, and you try to associate that temperature increase to estimates of mental health issues and diseases. So, for example, in these studies, we have association of between the increase of 1 centigrade degree in 5 years, and 2 percentage point increase of level of mental health. Then trauma-related is also like PTSD following disaster, usually around 30% increase because of various components. Flooding expected to increase in Northeast is associated with PTSD. Evacuation is another important driver. Evacuate any location due to natural disaster can increase the PTSD. We're talking about older people, of course, more than younger ones because of the impact of the evacuation. But again, PTSD, another point that is being related to climate changes and differences in climate change. Heat and suicide also, there's a bunch of studies here looking into this with different sort of estimates. Violence, climate change is associated with collective violence in combination with other factors, scarcity of cropland and other resources, heat associated with interpersonal violence and assault injuries. This is another part of the literature on mental health and climate change. And psychiatric, the impact on psychiatric patients is also important because schizophrenic patients can have impaired thermoregulation. This is a kind of an hypothesis mechanism. But then medication should be adjusted as well as for the cardiovascular patients. Also in this context, we have to be aware of the potential sort of synergies between the heat wave and some types of treatment that are already administered to these patients, similarly to the cardiovascular patients. Eco-anxiety is another area of research where people become worried about the climate change even more and more. So this is another area of research that is actually increasing pretty much because I think it's a common sense that people get worried, the workers and the communities about what can happen. Chronic disease is actually important because it's actually considered as an epidemic related to climate change. It's important to understand the kidney function and the anatomy. We know what the kidneys are and what they are there for. So this is like a filter that has to work very effectively. And the kidneys are actually basically formed by nephron units, and in each unit you have different sections, the glomerular filtration, the reabsorption in the tubular components, and in each one of these components we have potential mechanisms of action due to different types of toxic agents, nephrotoxic agents that can be, here you see example, they can be medication, but also they can be metals like lead, mercury, and many others, and pesticides. So actually there's a lot of literature telling us that there's different action, mechanisms of action in the different parts of the nephron, and there are different biomarkers that we can use to sort of try to understand what's happening and where it is happening. The different biomarkers can be related to functions that are happening in the different parts. So this is a very important type of research that is fundamental to understand potentially the mechanisms and to have ideas of how to use biomarkers for prevention and screening. This is a very, very important area of research, and there's a lot of new biomarkers that are sort of tested because of course they are our important tools for screening and prevention. So it's important to have a basic knowledge about this. This is like a fundamental paper with different authors from different parts of the world: U.S., El Salvador, Mexico, Brazil, Sri Lanka, India, Thailand, Sweden, and Turkey. And this was a kind of a paper that was actually important to set the stage for this type of disease. What is this? This is the chronic kidney disease is related to heat exposure, physical exertion, inadequate hydration. These three mechanisms leading to CKD, which is different in this case from the typical chronic diseases due to diabetes, hypertension, or glomerulonephritis. Epidemics of CKD are consistent with heat stress, and the nephropathy is actually, sorry, I don't know how I'm going to do it with the time. Okay. for a minute. Heat stress is actually spreading in different areas of the world where we have increasing temperature. Maybe a first epidemic due to global warming, and of course we need a lot of action into this at different levels. So the mechanisms are there. The heat stress, water shortage, overexertion can lead to different components, leading into repeated acute kidney injury and chronic interstitial fibrosis. I think that, okay, here's another map showing places with high temperature, and the top 10 of these places include Central America, Honduras, not only Central America, but also Myanmar, Haiti, Nicaragua, Philippines, Bangladesh, Pakistan, Vietnam, Guatemala, Thailand. We're saying Central America because many countries are actually in this particular area, which is important for many reasons, and also the impact of hurricanes and natural disasters is happening there. But of course, other parts of the world as well. This is India, and again, all these maps you see is not really accurate. As I was saying before, improve the technologies of mapping the temperature will actually give us better information. But here, it's actually first evidence of certain areas that are more impacted by the disease and overlap those with the temperature. And also here's more, I think it's more evident in Central America where the site of epidemics are clearly certain parts that are impacted by the temperature. So when I say the site of epidemic, of course, into this context, we have to understand that it's very important to have good data, of course, not only about the temperature, where is it increasing exactly, but we need good data also about the disease. So here's the sort of important challenge and limitation at the moment, because the knowledge about where exactly is this disease is really not that accurate. And of course, we need to know exactly what are we talking about. So we need a consent about what type of disease are we dealing with, and have a clear consensus of the diagnostic protocol. So we need better data, I believe, because I see a lot of discrepancies in a lot of different ways in these different countries. Even in Central America, one country has different sort of assessment from the other one. So when we see these maps, we have to consider all this, because there's a lot of, not inaccuracy, but I think the data are what they are. So there's lack of registration. We don't know exactly about all these cases, basically. Well, but the evidence that is telling us that that certainly is a problem, and the problem is increasing. All these countries in Central America are paying a lot of money every year because they have to use this money to treat the dialysis, and so this is a real problem reflected by their needs, their financial needs. And of course, it's a problem, and it's intervention and prevention. This was a nice article in Al Jazeera, basically, sometime in 2018, showing the sugarcane workers in El Salvador, and stories about workers. This person at age 39, already suffering from heat stress nephropathy. Both the father and the brother died from the disease, and of course they are there with physical exertion, dehydration, and that's a very terrible mix for this type of disease. And what we know about the exposure to chemicals is actually another important point here. Metals and pesticides definitely can play a role into this. I think that, well, the problem is that disease is asymptomatic, and so it's very difficult to track these cases at an early stage unless we have a screening in place, a screening protocol in place. The histological evidence is kind of mixed, interstitial fibrosis, low-grade inflammation, tubular, but also glomerular, tubular and glomerular lesions, which is telling us that, if you remember the slide previously, there are different sort of mechanisms certainly involved here. And there are studies showing the importance of the physical exertion here, applying these accelerometers when they cut the sugar canes and try to quantify the physical exertion. There are good employers like Mr. Juan Wright that are actually sort of collaborating into trying to understand how is it possible to prevent this illness in the workers. These are studies using cooling stations and water to supply the workers with fluids. Not easy because when they work there's nothing, and so this is important, simple way to try to understand the importance of these elements in terms of prevention. This is a typical picture showing the physical effort and the physical workload for these workers, and here's some new studies showing basically, I would say, what are the factors involved in this type of disease, and this is clearly a multifactorial disease. So we have the water intake, we have the pre-existing low glomerular kidney function that can be already not ideal. We can have different types of workers involved into the picture, and also when we have a multifactorial disease, we have to be able to address all of these factors because the importance for our research now is to understand how the disease is influenced by all these different factors that can play differently in different areas. The exposure to pesticides definitely can play a role, and actually all these studies are now also in California and in Florida, so I think it's an evidence that is being built about the existence of the disease, and I think that the part looking into the mechanisms is still lacking of sufficient power to understand how all these factors can interact between each other, because if you consider one study, you have maybe 4 or 5 factors, and other studies have other factors, but we need definitely some bigger power to understand how all these factors can interact, because this is definitely a multifactorial disease and we need better power. So we need larger studies definitely to have better ideas of the implications and the mechanisms and the potential for prevention. There is also evidence linking air pollution in general with the chronic disease, and this is opening up another sort of types of studies looking into the environmental exposure and the association with the chronic kidney disease. So in conclusion, the health impacts of climate change are several, from a cardiovascular to the kidney involvement, and it's important obviously to keep up with the agenda in terms of research, but also in terms of intervention to provide better knowledge in all these components. And again, this is a part of the future of work agenda. So I'm pretty sure that being part of that agenda will provide more opportunities for research and studies and intervention, also for everything is related to climate change as a potential hazard for the workers. I think this is it. Thank you for your attention.